Hi everyone, my name is Carla Mauricio and I am happy to welcome you to our online conversations on COVID. Do you know the impact that COVID can have on the cardiovascular system? Well, today we have the chance to speak to two experts on cardiovascular diseases. I'm delighted to introduce you to Christopher Mayer, scientist at the Austrian Institute of Technology and chair of the Cost Action Vasgage Net, a network that is doing research in vascular aging, and Rosa Bruno, who is medical doctor and researcher at the Paris Cardiovascular Research Center at INSERM in Paris. And she is also the principal investigator of the Cartesian study, a study that she will also explain us about, and a core member of the same action, Vasgage Net. So I will start by asking you, Rosa Maria, what is vascular aging?
So, thank you. So what is vascular aging? We can say that a concept that is increasingly accepted in the scientific community is that your vascular age might be very different from your chronological age. Mm-hmm. So the question is, the fact is, the arteries with aging, they become stiffer and they develop plaques, the fat depots. So this process is almost physiological. So it's normal with aging to develop some of these alterations. But indeed, what we see that not all the people has the same evolution of vascular aging over time. So in other words, you might be 40 and your arteries may look like somebody who is 60 years old. So mm-hmm. This is the problem. And what can determine something like this? A great difference between the vascular age and the chronological age. These are factors like your lifestyle, so how you eat, how much you are doing physical activity, and also the exposure to cardiovascular risk factor, so high blood pressure, diabetes, high cholesterol. All these things make the process of vascular aging accelerate. So the problem is that even the same risk factor might have a different impact in different people. So what it is important is that we have to measure vascular aging. So we have to have a look to the arteries directly. Now it is something that it is quite simple to do now. We have many non-invasive devices who allow us to measure how healthy are your arteries, and so you can have this information, which is your vascular age. And this may help you to have a better management of patients, because if you know it is vascular age, you can treat them more appropriately, and you can start the preventive actions, for example.
Mm-hmm, indeed. All right, thank you, Rosa Maria. Then following up on that, last year, both you and Christopher decided to create the network for research in vascular aging, a cost action. So could you please explain, maybe Christopher, why did you decide to set up that action, and what is the main aim of it?
So welcome from my side as well. Yeah, I'm really happy that I'm here and we can present our cost action and our aims here. So it's, I think, kind of a funny story, because a couple of years ago we organized a summer school for my supervisor, PhD supervisor, who retired, and we organized this summer school in Tuscany in Italy, and we invited Rosa Maria as one of the external guests to bring their view into our field, because I'm an engineer, we are mathematicians, and she's a medical doctor. So we thought, okay, it would be good to bring some real domain knowledge into our training school as well for students. And afterwards, Rosa Maria and we met a couple of times at different conferences and so on. And then we said, okay, it would be good to have such training schools on a regular basis for the young investigators in arterial stiffness, vascular aging, and so on. And that's why we searched for some funding opportunities, and one of them was the cost association and the cost actions. So we decided, together with 2 or 3 colleagues from Paris, Vienna, and right now back to Australia, we decided to write a proposal for a cost action, and we were successful. So that's why we are here right now. And one of the possibilities is to organize training schools right now. Unfortunately, with the COVID-19 situation, it's a little bit harder right now, but we will see how it's evolving. Yes, and the overall objective of the cost action is, as Rosa Maria mentioned, there are a couple of non-invasive techniques to measure arterial stiffness, but there are some problems as well. So, for example, there is not sufficient clinical validation. There are different approaches measuring different things, but not saying the same thing. So harmonization is missing. And as well, the promotion of this, so it's really some fragmentation in the expertise, I would say. So the overall game was to refine these measurements, to harmonize the techniques, and to promote them, not only in Western Europe, but as well to inclusive targeted countries, other countries where it's not that the concept of vascular aging is not yet well established. So this will help to improve clinical practice and hopefully reduce the global burden of cardiovascular disease in the long term. So that's more or less why we did it. So it was about the activities, but as well about the research goals and research objectives, which are the unanswered questions, I would say.
Indeed. And also, then COVID happened, and on top of the aims and the objectives that you had marked yourself for the action, it turns out as well that some core members in the action start collaborating in a project called Cartesian, together with the Arteria Society. Rosa Maria, could you tell us more about it in context of COVID, please?
Yes, so the story was a little bit like this. So I arrived in a new country to work. I started working in Paris, and when the pandemic starts, indeed, I could not work as a doctor because I hadn't already all the authorization to do my profession. So I was confined at home. I could do only research working, and my current research projects were frozen because of the pandemic. So it was a little bit difficult situation, I would say. And so I started studying a lot about this COVID infection. And so the more I studied, the more I understood that indeed this virus is really a damage for the arteries. Is infecting directly the cells of the vascular endothelium, and it may induce a permanent damage on these arteries. Furthermore, this virus is even more dangerous for people who has already some damage in their arteries. So indeed, I discovered that these pandemics, I could really contribute to this because it wasn't my skills. And the very good things is that in the VascEdgeNet, I am the leader of the working group dealing with big data and registries. So we were already a group of scientists trying to gather all the existing knowledge about vascular aging to provide solid evidence to use these measures of vascular aging in the clinical practice. So we were really perfectly placed. We had already a structure, an organization, a network to start working on this virus. So this is how the project started. We started discussing about this and we set up a project. In our project, we will follow up people who survived the infection a few months after they are survived from this infection, to see if there are some permanent consequences of this infection on the arteries. So if the COVID-19 is a cause of accelerated vascular aging. So, this network established by the cost action was really powerful because we managed to bring together different countries. By now, we had already 30 different centers participating to the study from 12 different countries. So we have the potential to acquire data about thousands of patients, and so to have more information about what this disease is doing in the long term, so that we can establish some protective treatments in these individuals if needed. So this is a little bit the aim of the study.
Yeah. It's indeed very, very interesting, and it's very timely. The fact that you found yourself as part of the action. So I saw, whilst I was learning a little bit more about the Cartesian study, that most people in the scientific committee of this project are members of the action. So how would you say being part of the action helped you and Christopher to get involved and to set up such a project?
So indeed, it was really a unique opportunity because we were already connected in the actions of the cost action, and people with expertise on the same subject, both from the medical side, from the engineering side, also from the industry, and it is easy when there's the possibility to network in this way. It is easy to develop the ideas quickly, and this is what was needed in this moment.
Yeah, I imagine that the fact that you already had the connections made, you already knew the people that helped you. So maybe Christopher can add.
Yes, I can add something here as well. I think we know each other for quite some years. Some people and some partners within the cost action or in our network right now. But with the openness of this cost action, it also allowed us to get to know or to work together with new countries and new clinical partners we would have never thought of perhaps before. So I think that's another chance, because we have all our scientific network, but right now through the cost action, it was another multiplier, I would say, because there were some other scientific partners suggesting someone to join. And so right now it's an even larger network, and it's more countries being part of it. And for example, we used it here with the idea of the Cartesian study to spread it in this network. Right now in our network, there are, I don't know, 180 participants more or less from 33 countries. So we use this as a multiplier as well, because again, it started all with a smaller group within this cost action or with this, but right now it's multiplying and expanding as well. And the other thing, as Rosa Maria just mentioned before, the network is a collaboration of engineers, medical doctors, companies. And right now, for example, this Cartesian study is more or less started without any funding, or just some seeding funding from the Artery Society. But right now, already some companies said, okay, no, we can provide you some devices for measuring here. We can provide you something like that. And I think that's the uniqueness about networks like that. Everybody is trying to support and collaborate. Yes, so yeah, so I think that's really perfect about this cost action. This one, or I think it's for others, it's the same. You create a network and then you can use it for different scientific initiatives or for, I don't know, new research projects and so on. Yeah,
yeah, or even in this current situation, even to tackle
yes.
a scientific challenge, right?
Yes.
Or which is also a societal challenge at the same time.
No, and normally you have to find your partners, and it's quite cumbersome to find and takes time to find your partners. But here we already have the network, so we can just say, okay, who wants to participate? And if they want to participate, it's from from today to tomorrow we can start it. So that's really a big chance. And with all the current situation with COVID-19, we shouldn't wait too long, because it's now going on and we have to start the clinical or the medical study right now. We can't start it in a year, because then it's hopefully all over. Nobody knows, but right now it's the peak right now, so we have to start now. And that's the great thing about the already existing network in this cost action. And probably we can as well use like some of the activities like short-term scientific missions, which could support this study as well and bring people from one institution to the other just to work in this project. So yeah, there are a couple of opportunities and possibilities, and
that sounds indeed very promising, I must say. So I'll make sure we follow up on that. And if indeed you manage to also collaborate with some companies, it's also great news.
Yes, we were really surprised indeed, the enthusiasm that we raised with this initiative. And we were really surprised to receive so many offers of support from the industry, for example, from the different partners all around Europe. And it's...
How did that happen though? Like, did they get in touch with you, or it came through your contacts?
No, we have to admit they were already part of our network. So in the proposal phase, we already contacted some companies. But as you know, it's as a secondary proposer, it's kind of just signing it or online filling it in, but it doesn't mean anything. So we had some companies already in there. They are already active in some other working group activities as well. So we are, I think, really lucky, because the companies, they're really interested in it. For example, there's as well a vice working group leader from a company in our cost action. So it's not just about science and doing research from a research institution and not from a company side. So I think we were already in a lucky starting point here. But I think, so that's why we distributed this information about this Cartesian study within our network. And the answers were not just from the clinical trial side, but as well from the companies. And it was just positive answers. And we want to collaborate. How can we contribute? What can we do? How can we participate? So that's, I think, a big chance here as well.
Absolutely, yeah. And just one last question for both of you. I would like to know, at the professional level, what does it mean to have the chance to be involved in such a cost action?
I would say it's, for me, it's really a unique opportunity, because as a stage of my career, I would say I'm a mid-career researcher, no? And it is a fantastic opportunity to start challenging myself in a leadership role. And this is so important to grow as a researcher in the next stage of the profession. And the other thing is the possibility to interact with different disciplines. So in this network, I can challenge myself in the interaction with other clinicians, but also with the basic scientists, with the engineers, with the mathematicians, to achieve the same objective. This is, I think, really the added value of the cost action.
Interdisciplinarity, yeah, indeed. And people from multiple areas and...
No, absolutely. This is really a growing potential for a researcher. For the researcher at each stage, I may imagine that it's the same for other people at different stages. For young investigators, is a fantastic opportunities too. Indeed, in our cost action, we have a very large proportion of young investigators as group leaders, as well as participants in the working groups activities. And I think for them, it's the same. I think it's really a possibility to grow all together, to know what's happening in the other countries, in sister disciplines, in order to make science progress.
What would you say to it, Christopher?
Yeah, so I fully agree with all Rosa Maria has said, because it's a great chance for us, as Rosa Maria said or mentioned, and we elaborated at the beginning, we as young investigators or middle career, whatever you call it, we initiated all this, so this cost action. So it was not done by the senior researchers in this field or whatever. So it was not by the our seniors or our supervisors, but we did it. And we did it, and we have the full support of them. So so it's not about them or us, they support us and they want us to do it. So, and I think that's a big chance for us and for, I don't know, me personally. Yes, I've collaborated quite a lot with different research projects, and I've coordinated smaller ones and so on, European projects as well. But this is I don't know, a chance for all of us, because it's totally in our research focus, and it's, I would say that the network right now is huge, because we have already 33 countries in Europe. It's increasing. We have some international partner countries with more than 160 participants. And I think, yeah, I really like it. I have to admit, I would really like to participate more from the scientific point of view in the working groups, but it's not possible as the chair right now, because it's more about the administration and trying to bring everybody together and in line. But I'm really happy that we have a really great team with the working group leaders, vice working group leaders, vice chair. So it's working really well. Yes, but it's a big chance for everybody, I would say. And I really liked it. I think you already saw the video about our thank you video for the medical doctors. That's one thing I want to mention here as well.
It was beautiful.
Yes, because we have a really great collaboration between engineers, medical doctors who are really frontline COVID-19 involved right now. And yes, so we said, one of our members from Working Group 5, Rachel from Australia originally, or in Paris, she had the idea, just let's do a thank you video. And yes, it's great to see the responses by the other participants to contribute, and then afterwards to see the responses from the medical doctors. And that's what I really like about this network. It's all different disciplines and different characters, but all working together to reach the same goal, I would say.
Okay, well, I'm very glad to hear those experiences, so first-hand experiences from your participation in a cost action. I would like to thank you very much for your time, and I wish you all the best, both in the cost action, but also in the Cartesian study. And we will be looking closely to it, to see how it evolves. Thank you very much.
Thanks a lot as well. Thanks for the possibility to talk to you.